How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, we're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hi, you're watching DNA Today, a multi-award-winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor, and your host. At the end of 2013, the FDA approved the first CRISPR treatment. CRISPR has now successfully been used to treat sickle cell, and I'd even venture to use the term cure, which we'll talk about with our guest today. So we are talking with the first person in the world who was cured from a genetic condition using CRISPR, Victoria Gray. Victoria is a patient advocate and an international speaker from Mississippi. She's also a wife and mother of 4 children. Since being treated with CRISPR, she has been featured in nearly every publication, including PBS, NPR, Forbes, Good Morning America, New York Times. The list goes on and on and on. So thank you so much, Victoria, for taking the time to come on the show, educate our audience about sickle cell and kind of talking about your experience with CRISPR. So thank you so much. I've been really looking forward to talking to you.
Thank you for having me. I'm happy to be here.
So before we dive into this groundbreaking accomplishment in genetics and your role in, I don't know if we really even have textbooks anymore. If we do, your name will be in them in terms of this historical context, but also wanted to highlight a lot about the sickle cell community and just how much this is such a light in the community. And with that, I want to learn more about your experience with sickle cell and what led you to pursue the CRISPR treatment in the first place. Can you tell us a little bit about how sickle cell has affected you over your life and really kind of shedding a light on how hard this condition is? And for listeners, we've gotten to talk a little bit before, so I know Victoria a little bit.
Well, my experience, I've had my first crisis and received my diagnosis at 3 months. So throughout my whole childhood, it was normal for me to just have pain episodes. That was my normal. And that mean I had clinic visits every year, scheduled monthly. Then the pain episodes, what we call pain crisis, is severe pain that would take away the ability for me to use my arms, my legs, and it was just terrible. My school days wasn't regular. I couldn't attend school on a regular basis, so my pain would come out of the blue, and that meant a week-long to 2 weeks-long hospital stays for me. And it progressed over the years. From childhood, I say elementary to 8th grade, I probably would go to the hospital 3-4 times a year. But as I got older and moved on to college, those visits became more frequent, to 7 to 8 times a year. And by 2015, after I got a port infection, those visits became monthly, of going to the ER, getting admitted to the hospital. So my experience with sickle cell was a terrible experience, and it also caused my heart to start failing.
And that is just so scary in terms of having it be that severe. And not only is it impacting your life in terms of how often you are having to pause your life and get treatment, but the pain crises I've just heard from you and other people in the community are just, I don't even know if I have words for how horrendous it is. Could you share a little bit more in terms of what a pain crisis feels like? Because you said it can often come out of the blue. It's not like you necessarily always have signs of like, oh, this is coming.
No, they could come on quick, out of the blue. You can go from being normal to then lightning strikes you. You feel like this jolt of electricity move through your body, and it's not only a electrical jolt. it feels like you got hit by a truck at the same time because you're aching and you got this electrical and glass like pain flowing through your body, your veins, and it takes your breath away. You can't do anything, and it's scary because you don't know how long it's gonna last, and then when it stops, you don't know when it's coming back.
So just the mental toll of that, of kind of bracing yourself, like, okay, I feel a little bit better, but is it about to come back? And you've described to me that even breathing deeply would be very painful. So you'd be taking shallow breaths, even just to try to kind of get through. I don't know, like how long does a pain crisis typically last? Is it like it really differs, or is it kind of a common like this amount of time?
No, it differs every time. So it is so unpredictable. That what makes it hard. Some days, um, I could have a pain crisis, go to the ER, get a shot, and I'm okay. It's gone after a night of sleep. And then there's some days where I hurt for weeks at a time. And my
Wow.
longest hospital stay was 3 months. So you never know.
Wow. And I mean, and your life just whatever you had planned, it just goes out the window, even very important things. And you mentioned like going to the ER or emergency department. When you have, obviously many times in your life gone to you're having a pain crisis and you're like, okay, I'm going to go to the ER. What has been common responses from even the person at the front desk that's checking you in, all the way to the healthcare providers that you're meeting with, once you say, I'm having a pain crisis, I have sickle cell? What is often that response? How were you treated in a lot of those situations?
Once I became an adult and was no longer in pediatric care, the response was always irritation. Like as soon as they hear the word sickle cell come out of my mouth, is then this eye rolling, and you hear them whispering among themselves like another sickle cell patient. Here we go again, and things like, wasn't she here last month or last week? As though it was something that I had control over.
Which is just wild to me because this sickle cell is a well known disorder. It is not an ultra rare, nano rare disorder where, oh, we don't know much about it, so people haven't heard of it. Most people, if they've heard of some kind of autosomal recessive condition like this is, they would know sickle cell. I would say that's the most common one that people are aware of. So it's shocking and so disturbing to me that healthcare providers have that reaction because, if anything, they're like, I would think, oh, we have a diagnosis. Isn't there protocols just to follow because we know about these pain crises? This is not an unknown thing. It's very much documented in research. So this is just, and I've heard this from other people. So
Right.
I'm shocked in the sense of how can another human treat someone else like that when there's an explanation behind it? But
It
it's
just comes
just
along, it has stigma attached to it. When sickle cell and drug seeking, somehow throughout history, they attach that together. Um, so when they hear sickle cell, they don't take the time to listen to the patient. It's just judge out the gate that you're there for pain medicine.
which obviously you need pain medicine because it's a pain crisis. So hello, that makes sense. What kind of medications were you taking? Obviously, before we're talking all before you had the CRISPR treatment. So, what types of medications are you on? Because I mean, I know I'm not in pharmacy, but I know some names, and I was surprised to hear just how many you were on.
Right before I decided to choose CRISPR, I was on fentanyl patch. I had Dilaudid and Percocet at home, and even on a regimen, it still wouldn't take care of the pain that I was feeling in my body from sickle cell disease.
Wow. So just so many different pain medications, and that there is this, as you said, stigma of people that have sickle cell and that are having a pain crisis are like, oh, they're a drug seeker, which I understand in our healthcare system. We do have an opioid epidemic. This is a problem. However, when someone has a genetic diagnosis that explains the pain, it's like, okay, that's our answer right there. I understand, especially when people are out of state and it's like, okay, this is kind of fishy, especially when you can't see the pain. Do you feel
Right.
like that's part of it with healthcare providers, that you can't just point to, I have a broken arm, I need pain medication?
I think that's part of it, but how I really feel, I believe, is racism. Because most people that enter the ERs in America with sickle cell disease are African Americans. So we're already judged just because we're Black. So when you come in there and you're calm, because had to learn how to be calm through my pain to keep from driving myself insane. So when they look at me and I look like this and I'm calm and explain what's going on, they just don't believe me, because one of their thoughts is, how can you be so calm and in pain? How can you look like that? I heard people say, oh, you don't look like you're hurting, just because they felt that I was pretty. And that wasn't even something that I was trying to give off. That's another thing. I couldn't help the way I look. It's just insane. And it was heartbreaking to me and discouraging that the people that I came to looking for help judged me, and they caused more harm than they did help, because I end up being depressed.
Yeah, no, it completely makes sense that it's just, it's shocking how people have that take effect. And there's a lot of people that the other common autosomal recessive condition would be cystic fibrosis. I think that is maybe the second one that people know of. And we've done episodes on the show, I'll link to them in the show notes, in terms of that sickle cell affects more people than cystic fibrosis does, if I'm remembering right. I will fact check this. And there's so much more money that has gone into cystic fibrosis treatment. And that's part of the reason why I, as an outsider, am very excited that we have a CRISPR treatment for sickle cell, because there's been this really big lack. And obviously people in the cystic fibrosis community very much deserve medications and all of this, but it is, I imagine from your perspective, frustrating that there's been a lot more research and support for a condition that affects less people. And cystic fibrosis affects mostly people of recent European ancestry. So I think, even bringing up the racism aspect to that, and just the discrepancy of care with that, is that something that you've heard from other people, that you agree, disagree with?
Yes, it's something that I heard from other people. Is the way I felt growing up, even going to see my hematologist. The clinic there, they treat sickle cell patients and cancer patients, but when I go there, I see cancer flyers, but there's nothing for me. There's no signs, no posters, no resources for people with sickle cell disease. So I felt like even the places that I was receiving treatment at didn't care about me, or my condition, just because I was African American. And
Yeah.
it's heartbreaking. We all need help. I support in the cystic fibrosis community. I feel like suffering is suffering. It shouldn't be attached to a race or skin color. Pain is pain, and everyone deserves to have a life. We should help one another instead of judging. So I just don't understand why I always got judged. Being 18, once I came out of pediatric care, no one, didn't receive any type of sympathy anymore. um, it was totally different, a change that I was not prepared for.
Yeah, just the transition from being in the pediatric space and being impatient in that space to being like, okay, now you're an adult, and how drastically things change that you're talking about. And I mean, as you mentioned, you were diagnosed at 3 months. So you don't know a time or remember a time of not having this diagnosis. How much did healthcare providers educate you and your family about sickle cell and how it would affect you? How much did you have to teach yourself and fill in gaps?
I don't remember receiving a lot of education on sickle cell disease at all from my healthcare provider. Um, Pediatric care, they did explain that I didn't have normal red blood cells, and that when they change shape, that's what causes my pain. But once I transitioned to adult care, there was no information for me. I just show up to the visit and they ask me how I'm feeling, go over my lab work, and that was the end of the visit. I didn't receive any details. Everything that I learned about sickle cell disease, I had to learn on my own. And it wasn't good at the time I was researching. It was death, 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 death. And I stopped looking.
And that is just so scary to be educating yourself with this. Really, there are some scary statistics out there and information, like you're saying, like, oh, early death, I think is something that you read a lot for people that have sickle cell. And then to not have healthcare providers be not necessarily filtering the information, but tailoring it, I guess, to like what
Yes.
is age appropriate and also what's appropriate for you and your specific symptoms and what you have, because people with sickle cell have different symptoms. You know, we've been talking about your
Right.
experience, but also just building trust and rapport of healthcare providers building that with you. And that sounds like something that was lacking with the vast majority of healthcare providers that you've interacted with, either your own doctors and nurses, but also just when you walk into an ER because you need to be seen, of those new relationships. I mean, how important was it for you in having some kind of relationship trust as they're treating you? Were there some healthcare providers that were able to do this for you,
Yes,
or was it kind
I
of
did have some good nurses once I was admitted, and not everyone was all bad. And I did my pain management doctor that my hematologist sent me to. He was caring, and I did at one point have a hematologist that cared before he left. So I did have some positive role models and people that I looked up to when I was going through pain that actually took the time and didn't rush the visit, cared about what I was going through, just took the time to listen. I understood that there wasn't a lot of options for me, but I just wanted them to seem like they cared and what I had to say was important and not just a quick rushed visit.
yeah, I think that's so important. Is there aspects that you wish maybe as a young adult that you were educated about in different aspects of symptoms of sickle cell and certain doctors that you should be following up with, or it's recommended to, that you're like, I figured this out on my own and then booked my own appointment?
One thing that I wish I would have had early on was mental health care. A lot of people don't talk about that, but I wish I would have had therapy early on, because truth is there wasn't a whole lot of treatments. But I wish I had a therapist and a hematologist, a nurse that worked together for my care. So when the doctor did take the time to tell me that I was high risk for strokes or high risk for heart attacks, but also tell me how I can prevent that. But just throwing things out there. I had a doctor at one point, he just told me, oh, you got a big heart. After he had done x-rays, you got a big heart, you got a big heart. And I had to ask him, what does that mean? I heard you say it on multiple occasions. And it turned out once I booked my visit with a cardiologist, I had an enlarged heart, which was a problem.
Right,
Not to
that's a medical
speak,
diagnosis. That's not speaking to
right.
how amazing of a person you are, which is true, but this is separate.
Exactly.
Yes.
And then when I went back to him with the results, he was like, oh, that's what usually take you sicklers out.
How do you feel about the term sicklers?
I hate it. When I first heard it, I was like, what is this? Sickler? I'm Victoria, who happens to have sickle cell disease. I'm not a sickler. That's like a person who's actively out there making sickle cells or something.
Yeah.
I hate the term. Why label me as something? Can you ask me what I want to be called? And
Yeah, it's
then
such a
you,
simple thing.
and then
It
when you
just
put it in the
it's
term of
so
you sticklers,
derogatory.
I
Oh.
was like, what? It's like, oh, that's what usually take you sicklers out.
That sentence is just
And
unbelievable.
it's horrible. And I'm here looking for help, and I'm getting discouraged every time from people that I think are supposed to be the smartest people on earth. You know, I'm coming from pediatric care. I looked at my pediatricians as angels. I loved them. I had three, and I want to say their names. Can I? Um,
Oh, of course. You're the patient, so you're not breaking HIPAA.
yeah.
You can give as many shout outs as you want, Victoria.
Yeah, as a kid, I had Dr. Iyer, Dr. Smith, and Dr. Pullen. They were all UMC pediatric hematology doctors, and those were the best years of my life. They did a lot of preventive care. If they saw my counts was low while I was in clinic, they didn't wait for the pain to come. They gave me a unit of blood. I had my alpha juice blanket. The voice was comforting. They took the time. They gave me fluids in clinic. They did everything they could to keep me healthy. They didn't wait until the crisis came. So I had a better experience with sickle cell disease as a kid because of the care I received. And they also, my grandmother, whom I lived with as a kid, she had their phone number. She could call them in the middle of the night and they would meet me at the ER. This is not the same experience I had as an adult.
Yeah, as an adult, I remember you sharing uh, a couple different stories of
Mm-hmm.
just really breaking trust and lack of communication. Is there anything that you wanted to share on the show when it came to kind of what a difference in terms of your childhood of having so much support and having your grandmother be able to reach out to your pediatricians? I mean, that is amazing. And that shows like that the symptoms that you had as a kid, it was very, it was as managed as it could be, it sounds like.
Yes.
Whereas as an adult, you lost that.
Yes, I did lose it. Once I transitioned to adult care, I didn't have once I was going to my appointments, I wasn't seeing the same person. So I didn't feel comfortable opening up because a lot of them were med students. So I didn't know their name. I figured they weren't going to remember my name. So why tell them what's going on with me? Because the visit was rushed anyway. And when I had to go to the ERs, I was only treated by the doctors that was on call. And once admitted, a totally different doctor, the hospitalist. And I had to explain myself over and over. And the treatment and care was different. One ER visit, I had a nurse. He just stood over me. He said, "I feel sorry for you guys with sickle cell because you guys become addicted to the medicine from having to have it all those years, and it's inevitable that you all become addicts. And then you can no longer tell when your body just wants the medicine or if you're in a pain crisis." And he meant it. This is his true feelings, but he tells me this while I'm in crisis and trusting that you're going to help me. But now I don't trust that you're going to help me because you just told me how you view me. You view me as a drug addict who's fiending for drugs, and that's the only reason I'm here. And I'm so confused that I don't know that if I'm hurting or not. My body just wants the medicine. And I couldn't believe it.
Wow. Like you've
So,
lived your whole life with this condition. It's your body. You can tell when you're in a crisis versus, oh, other people that are addicts that are, oh, I'm coming down off of meds.
right.
I need that fix again. That to me, and I haven't experienced either of those, but to me, those seem like two different aspects. My mom's a drug and alcohol counselor, so I've kind of grown up learning a lot about
Yes.
addicts and just having, people in my family that have struggled. But to me, that seems very different because the symptoms also would be so different, I would imagine.
It is different, and but after hearing it over and over and over again, I started to question myself. So
Sure, you're like gaslighted a little
I
bit.
had to call my doctor, Dr. Locke, my family doctor, and he's always been open and honest with me. So I said, "Dr. Locke, how do I tell if I'm addicted to the medicine. So he asked me a few questions. He said, "Do you feel good when you receive the medicine?" I said, "No." He said, "Do you wake up thinking about the medicine?" I said, "No, it actually scares me. I don't like being distorted." And I said, "In truth be told, it don't really help that much with my pain." So
It's
I'm
like the
just,
opposite.
yeah. So he
Like,
said,
that
"That's
is
how
not what
you
an
know
addict
that
says.
you're not an addict. You don't
Yeah.
receive any sense of euphoria when you receive this medicine." So they made me question myself because the treatment was bad and it was repeated. It wasn't just one nurse or doctor mistreating me. I had another nurse who decided to experiment on me.
Which this is mind-boggling, listeners. I mean,
Yes.
hold on to your seat. Yeah. So tell us about this absolutely terrible nurse.
I had been in the hospital. I had a very bad pain crisis, but I seemed to be improving. I had been in there for a few days. So I was getting my medicine on a regular schedule. So I called her. I said, I need my pain medicine. So she comes in, and I felt safe with her because I had seen her for years. So she comes in, and I'm sitting up, tired of being in the bed, and she pushes the medicine in. We're having a conversation. And then I said, "Oh, I feel very tired." I was like, "I wanted to sit up for a while, but I need you to help me get in the bed." I got dizzy as soon as she gave me the medicine. So I fell asleep and I woke up. I was in so much pain. I just couldn't understand. I thought I was getting better. So I called her back in for medicine again because so many hours had passed by. And I asked her, she gave me the medicine. I said, "I just don't understand. I thought I was getting better. Now I'm hurting worse." And she said, "Well, actually, it's been about 10 hours since you had something for pain." And I said, "No, it hadn't been 10 hours. You gave me something about 4 hours ago, 4 to 5 hours ago." She said, "No, I actually gave you a big dose of Phenergan because I wanted to see what that does."
I wanted to see what that does.
Mm-hmm.
So she
And
was playing around and experimenting.
playing around with a medication that my doctor hadn't even prescribed for me because they usually give it to me for nausea, but in a small dose. But she gave me a big dose. That's why she said, I gave you a big dose of Phenergan because I wanted to see what that does. So it knocked me out. That explained the dizziness because I don't get dizzy and real sleepy once I get Dilaudid. My nose
And you're
usually
so
itches.
used to it. You're
Yes,
like, "Oh, this is the medication. This is what I normally feel. This is what's about to happen."
right.
You've been having these meds your whole life. So you know how it works.
And then when I decided to report her, the reaction I received from the head nurse who was over her, she said, "Oh, well, we don't feel that she did it maliciously, so we're not going to reprimand her. What we're going to do, we're just not going to let her come in here and give you anything else," as though I was the problem. But lo and behold, she did end up having to treat me again because it's a small hospital, and when another nurse calls out being sick, she had to fill their patients. So she did end up having to treat me again, and I felt so unsafe to the point where I called my husband, who was deployed, and I called my mom, and I said, "If I die while I'm in the hospital, don't accept that it was sickle cell disease." I said, "It won't hurt me anymore because I'll be gone. So just get an autopsy so you can know what happened to me because they're in here experimenting on me. And I can't look at the syringe and know what's in it because all the medicines are clear. So just don't accept a phone call saying that I died while I'm in crisis because more than likely that won't be true."
I mean, and that is the fact that your mindset went to this extreme shows what kind of situation you were in to prompt you to be thinking this and to reach out to your husband and mom and sharing this. Like, and it's just a lot of times when people talk about mistreatment and miscommunication and breaking trust with patients, a lot of it is from a historical context of, oh, in the past, especially, and please, I don't want to speak for, African Americans and Black people in terms of experiences, but from what we've seen in history, they're like the Tuskegee
Yes.
trials, the Henrietta Lacks in terms of her family's lack of education in terms of what they were doing, even into the 70s, even further on, that this is something that is still happening today. Because I hear when a lot of people talk about this in terms of racism, in terms of all of these kind of the intersectionality of, you're talking about having a genetic condition, being Black, that this is still an issue today. This is not an issue in the past.
Yes.
Am I getting that right? I don't want to put words in your mouth, of course.
Yes,
I just
you
want to
are.
highlight it.
You are getting it right, because that was my biggest fear, was what was going on today, how I was being treated. And what prompted me to make that phone call was the only other sickle cell patient that I knew that come to that hospital. He had recently passed away in the same hospital, and I had been told that it was under a suspicious circumstance, that once he called for his medicine, all of a sudden he started popping off sweats and he passed away and wasn't able to be resuscitated. So I had fears that that would be my destiny also. But I really didn't have other places to go, because I received this treatment at different hospitals. So it was scary, but I didn't have any other options.
Well, thank you for sharing this, because I can't imagine just how it is just to bring up so much of this trauma. So I just want to thank you for being open. And I can't imagine how many people this is resonating in terms of mistreatment, being a patient, for those that have sickle cell, but beyond that too, because obviously
Right.
this is your experience, but it's amplified by so many other people that have experienced this and that don't have a platform like now you do, in terms of being, you're a kind of a celebrity, I think, in the sense of in genetics. I mean, I think that's so hard. It puts a lot of pressure on you, and you're so well spoken, you're so open, and what a role model you are. But just being able to open up, it means so much to so many people. There was even someone that, I don't know if you want to tell the story of, you know what I'm talking about, of
Yeah.
surprising an individual that was very much a fan of yours and that you really influenced his life.
Yes, I had the opportunity to surprise Jimmy. So, through Good Morning America, and that feeling, I can't describe it. I was so overwhelmed with joy. He was full of joy. And to actually meet someone that was inspired by my story was it was amazing. And he moved forward with CRISPR, and he's had the same experience I had. And I never would have thought that to be possible, because I went from being just a voiceless sickle cell patient who was going through struggles and afraid to die and leave that my children behind. And Jimmy had those same fears. He wanted to be a part. He was expecting a child at the time when he began, and he wanted to be an active part of his child's life. And he had the same fears I had, with being afraid to go to the emergency room. So we suffered a lot at home, which had us bedbound from the bed to the couch and just to the bathroom, not being able to be a part of life and be with our spouses. So to know that I inspired him to move forward with this treatment that brought about this change, this transformation in his life, that was enough for me. Like, to know that I changed one person's life, impacted it in a positive way.
And it's so much more than one. Jimmy's story
Yes.
is one of many, because, as I said, you're the first person that was treated with CRISPR, not just for sickle cell, but for all genetic conditions, right? And I mean, obviously we've talked about a lot of your experiences and just how horrible and debilitating pain crises have been throughout your life. Was that the motivating factor of it got to a point where you were just not able to live your life to the fullest, as you said, and be active in your kid's life? You have 4 kids, so that's got to be a
Right.
busy life of just keeping up with them and being an active parent, as you said. Were those the aspects that motivated you the most to become the first person and enter the clinical trial for this CRISPR therapy that essentially cured your sickle cell, as we're going to be talking
Yes.
about?
My children, wanted to be here for my children was my biggest motivation, because at first I had pretty much given up on trying to be better. But once I got that phone call from my son's teacher telling me that well, she actually called me in for a meeting. And when I got there, she said his behavior had changed and he was just acting out because he was afraid I was going to die. So hearing that out loud from someone else, I knew then I had to fight to be here for my children, because if just the thought of me dying was hurting them and causing them to have behavior issues and wanted to be just around me all the time because they didn't know how much time they had left, I knew I had to be there. I couldn't miss um helping my daughters pick out wedding dresses.
Of course, Victoria. I mean, that is so impactful in that you have highlighted just how important mental health is that you talked about for yourself and just
Right.
having such a hard it for you. It wasn't a diagnostic odyssey or, oh, you received a diagnosis, but learning more of, oh my gosh, this is such a serious condition, and knowing people with sickle cell that pass away, even the person you mentioned in the same hospital as you were in at the time, and thinking about that. But then, and I'm not a parent, but I've heard from so many parents that, have this similar mindset of wanting to be mama bear and be protective of that, just escalates it so much in terms of wanting to protect your kids, but also be there for your kids, of having
Yes.
both. And just the anxiety of knowing as your kids have gotten older, of them understanding it on a deeper level of what sickle cell is and how it affects you or affected you, right? Things are
Right.
past tense now, which is great. But I mean, what type of information were you presented when learning about the clinical trial, like to figure out, was this a good match for you? Were there other types of like consequences, side effects that they brought up, like off-target effects is something I think about with CRISPR, that they're like, hey, you have to know this because, I mean, clinical trial, and you were like the first person. So
Yes.
that must have been very scary. And obviously your symptoms were severe enough to lead you to such an extreme measure to be taken, which turned out amazing. But it must have been scary to be learning this and making that decision.
Well, I wasn't terrified when Dr. Frangul, he approached me. I was in the hospital. I was going through a pain crisis, but we was already in the process of the testing to do a haplotransplant, and he was aware of my fears of graft versus host disease. So he presented the CRISPR option to me. He gave me a second option, and he did explain that it was new, it hadn't been done on a person, but he explained what was so crazy is that I happened to look back in my phone on yesterday and saw part of his explanation that I didn't remember.
Really?
Yes. Oh my goodness. And he explained that it was new, and the theory of it was that it could go in and change the gene that was um for hemoglobin F, to turn that switch back on so I can produce more hemoglobin F, which some sickle cell patients in Africa have sickle cell disease with high hemoglobin F, and they don't experience pain crisis because of it. And that this was a possibility of decreasing my pain and my suffering, and me not having so much of the side effects, or as heart attack and stroke, because I would have a healthier hemoglobin that would deliver the oxygen to my body that I needed. But there was the thought of the first. But my question to him at that time was, only questions I had was there a chance to graft versus host disease? And because that was my biggest fear. And when he said that there was no chance because the cells that were edited would be my own and my body wouldn't attack itself. And then I wanted to know, if I tried this and it failed, could I move forward with a transplant with my brother? And he reassured me that I could do it after a year. After hearing that and going home to pray and talking to God and say, Lord, if this is what you have for me, my gateway to my miracle, remove any fears or hesitation that I may have about it. Give me comfort and peace in it. And when I had comfort, I knew it was God. I felt like this was an answered prayer, because what I feared the most was graft versus host disease over anything else. Once that was off the table, it was a green light for me, a go.
Yeah,
So
because
I
that is a
didn't have a lot of
fear.
fears.
Yeah, it certainly is. It's a complication that any kind of bone marrow transplant we worry about, because usually bone marrow transplant, it's someone else's cells that don't have the same condition as the person that's receiving it. So
Right.
that person can make normal blood cells. And it's such a amazing concept and method that they take and what they did. And, if I'm getting all the science right, they took your bone marrow cells out, they used CRISPR to turn on the hemoglobin F, which stands for fetal. So when we're born, we are making certain red blood cells that are kind of in this just fetal, it kind of switches over after we're born, but turning that back on so that you can make healthy, round red blood cells that flow in your blood vessels and veins easier than that sickle shape of, then it gets stuck and that causes the pain crises. So being able to turn that on and then putting those cells back in your body, it's a self-transplant in a way that they're,
Yes.
I kind of use the term, they CRISPR them up, which is not a science term, but they CRISPR them up and then give them back to you. But it's just, it is amazing. I mean, how were you feeling on the day of the procedure when they were taking out the bone marrow cells? And then how long did it take to then edit them with CRISPR and put them back in? Like, what was that timeline like? What were your thoughts during this?
Oh my goodness. Like the days for mobilization, that's what they call that process. I would go into the hospital for 3 days. So they would give me the shot in the back of my arm to release my stem cells, and I have to go and get on this machine for hours for the collection. Anywhere up to, could be 6 hours.
Wow.
And where it's pulling my blood out and spinning it. But what I felt like my body was shaking. I said, hold up. I looked over at my husband. I said, is the bed shaking? And he's like,
Oh,
no.
no.
But they told me that was because of the calcium drop. And they just gave me calcium, and then I felt normal again. I watched videos, talked to my husband, took pictures. I really didn't think about it, because I knew I was just trying to be better for my babies that was at home. And then I came home for 1 month, and then I had to go back to do the collection again. So I had 2 collection phases, and both collection required 3 days on that machine.
Wow.
For 6 hours per day. So after the collection was over, I went home, and it took about 2 months for my cells to be ready.
That's longer than I would have thought. Wow.
Yeah, it took 2 months. It don't take 2 months, like Dr. Frankel explained. It don't take 2 months for the editing process, but they have to check the cells and make sure that they're good before they give them back to you. So quality control.
Yes.
Yes. So then once the cells were ready, I had to go through the conditioning phase. And that was when I received the 4 days of chemotherapy. And those days.
And that's to basically get your bone marrow just like completely emptied almost, right?
Yeah,
So that you
wipe
have
out the rest
nothing.
of it that's left, pretty
Yeah,
much.
because you don't want to have a mix of your own cells that don't have the hemoglobin F on and some that do. You want to make sure you're replacing it.
Yes, to make room for the new cells to enter and graft. But those days was uneventful. I didn't get sick or anything. It was just 2 weeks later, after I thought I was all good, I wasn't.
Uh,
Uh, but I want to talk about infusion day. It was the
yeah.
day I received my new cells. I was so happy. I got all dressed up. I had blue hair. I know you guys see the picture. Blue hair, purple nails. Oh my God. But Dr. Frankel, he just came in, he attached the syringe to my catheter that I had in my chest. And he did a fast push. The fast push, it sped my heart rate up a little bit. But it was only 3 valves and he manually pushed them in real quick. And after that, I just felt I even asked him, I said, "That's it?" He said, "Yeah, that's it, girl."
Wow.
And after the camera crew left out and it was just me and my dad in the room, I cried. It
Oh,
was they were tears of joy. I knew that this was the beginning of a new life for me, even though nothing had changed yet. It was faith. I knew God hadn't taken me through all of that in vain.
yeah.
So I cried, and my dad, he held me and he just said, "Vicky, I know God got something good in store for you. I know he does." And it was a day of rejoicing.
Wow. And just such a milestone for you of all of the pain over all of the years, and to be like, this is going to change it. This is going to cure me. And you didn't know at the time, again, clinical trial, like we weren't sure how it was going to go, but the role that faith has played with you and your family and just relying on that is, it seems to have really gotten you through a lot of really dark times.
Yes, it did. Growing up with my grandmother, we went to church all the time. And um, when I received my diagnosis at 3 months, they told my mom then that I would only live to see 7, if that. So, but my grandmother, she always told me once I was old enough to understand, about 4 when I was dealing with my own pain, she said, "Vicky, it's not what the doctor says, but God has the final say. God created you and he knows you better than anyone else. So he can see you through it no matter what it looks like, no matter what it feels like." So I held on to that
Yeah.
in my darkest days, that even though sometimes no one else was in the room, that God was there with me. Because there was time where I thought my heart would stop from the pain. I was like, this is not possible. How can any human handle this amount of pain? I just
Yeah.
knew my heart would stop, but God helped it kept beating, even when I didn't want it to, honestly. But I knew I couldn't give up. I had to trust God's plan, and the way I came about CRISPR and how I found it, I felt like it was something that God had molded just for me. It was purpose and fate being fulfilled that day. That God had a plan to not only deliver me, but other people dealing with sickle cell disease, rare disease, who had been told, there's nothing we can do, but nothing they can do, but it's always something God can do. He'll put the thought in the right person's mind that they can't sleep because they up thinking about how can I get this bacteria to change genetics, and everybody else think they crazy, but it happens. I'm here. And
You're here.
I'm so grateful. I'm so grateful to God and to the people that managed through those sleepless nights and didn't, just throw away those thoughts out of their head that something like bacteria or a virus can be the answer, you know. And I thank God
I mean,
every day.
it is remarkable that we had the landmark CRISPR paper, which I can link to in the show notes, around 2012. And less than 10 years later, right? Because it was 2019 that this happened.
2019.
Yeah. That less than 10 years later, what? I can't even do math. 7 years later, you were getting this. It's amazing how fast. And it's, as you said, a lot of scientists being like, we got to figure this out. We got to utilize this bacteria, naturally occurring immune system kind of thing, and turn it into a cure for sickle cell. I mean, how far-fetched does that sound, right? If we told people back in 2012, oh yeah, there's going to be this person named Victoria Gray that is going to get a cure for sickle cell based off something we discovered in bacteria. I mean, it is remarkable. And
you would think they were back in my day growing up, I was born in the 80s. Mad scientists. That's what
mad scientists.
Call them. Yep. These are mad scientists. You know, you don't need to treat anybody. You're crazy. But man, it turned, like I like to say, science fiction has now become fact.
I say it all the time on this show, Victoria, like so much. And I want to highlight as we end here of how much your life has transformed since your CRISPR. Can I call it a cure? I've been kind of like, can I call it a cure? In your life, has it been a cure?
For me, it has, because just a glimpse of my life right before CRISPR. I had an in-home caregiver. She had to help me get in the tub because that was too much for me. She had to help prepare my meals, make my bed, put on my clothes sometimes. I couldn't work. I couldn't go outside and get on the trampoline with my kids. I couldn't fly to be with my husband doing deployments. After CRISPR, I take care of Victoria.
Nice.
I comb my own hair, do my own makeup. I can take a bath, the things people take for granted. I can dress myself. I can get out there and run with my kids, even though my teenage boys are going to beat me every time.
They're going to run circles around you, but hey, you're running.
But look, I'm in the game. I'm in the game. I'm not on the sidelines anymore. I get to be a part of my children's life. My first flight ever was to Washington, D.C. to visit my husband while he was on deployment. And he had been there for me. This was my first time where I felt like I was able to be there for him.
Wow.
And I work full time. My second flight was an international flight to London.
You just were like, let's do this.
I went from the ground and took off. Things have drastically changed. Like, I'm fulfilling dreams that I could have never imagined. I started off wanting to be a doctor and then went down to trying to be a nurse, and I always had to change my dreams and couldn't even accomplish that because I just wanted to change lives. But now I realize through saying yes to CRISPR treatment, I have possibly saved more lives and touched more lives than I ever would have touched or changed as a doctor or a nurse.
You already have, Victoria. You already have. And all of the downstream people that right now we have this CRISPR treatment for sickle cell, but this is just the first. We will have CRISPR treatments for so many other disorders, cancer. I mean, so many things that we can't even imagine right now.
Right.
And someone had to be first. And you said, I'm doing it. You did it for your own life, but you also saw it as an opportunity to do it, to show people like Jimmy,
yes,
hey, this can work and this can change your life. So I don't even know how to thank you enough on behalf of the scientific community, the sickle cell community, people that have genetic conditions. I mean, just so many groups of people that have benefited from you saying, I'm going to take that step and do it. I mean, thank you for not only doing this, but coming on DNA Today and sharing so many vulnerable aspects of your life and what led up to CRISPR. And I can't thank you enough for this incredible conversation and how much you've been able to open up, because I know a lot of times that you've been interviewed, it's quick interviews and you can't necessarily get into it and really share what you want to. So
right.
Thank you so much, Victoria. I can't express it enough.
You're welcome. And I want to say thank you, Kira. Thank you for having me, giving me this opportunity to share a deeper side of who I am and why I chose to do CRISPR. It wasn't just for me. I knew someone had to open the door because I wanted change. So it was time for me to be brave. And that was my first time where I was in the hospital by choice.
Wow.
Sickle cell had always put me there at these crises, but I made a choice to be there this time, and it was a choice to fight.
Wow. Well, Victoria Gray, the first person to be cured from a genetic condition from CRISPR. Thank you.
Thank you.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.
We're all made of DNA. We're all made of the same chemical DNA.